started, and we might have a couple more trickling in later, but my name is Skylar Ferentz. I'm a professional outreach coordinator for, I always want to say the Upper Iowa Peacocks. I gave so many speeches for them, but for Iowa Donor Network, that's where I went to college. And just a little bit about what you guys will learn today, just a little bit about some legislation, the difference between organ and tissue donation, and some common concerns that the general public has about donation, and then what we do post-donation follow-up wise. And please, if you have any questions, feel free to ask in the middle of the presentation or wait to the end, whatever you would like to do. A little bit about myself before we get into this. I came from the recovery side of things. Sorry, I feel like my back is to you.
You're okay.
I was recovering tissue and organs for about 8 months before I transitioned into this role. So I'm learning as well. If you guys have questions I'm not able to answer, I definitely know someone who can. So a little bit about us. We are a nonprofit organization, a group of people just extremely passionate about donation. This is a picture of us in April at our groundbreaking ceremony in Altoona, and we actually just moved in this week. Our building is brand new. Our Johnston staff, we just completely outgrew our Johnston building, so now we are in Altoona, and it is such an awesome building. And I know it's quite the hike for you guys, but there is an open house in April, and it's a beautiful open space concept. I really encourage you guys to go if you're free, but I'll send Jill the email about the invite. And our mission, we're extremely passionate about our mission, transforming lives through organ and tissue donation. We constantly revamp our mission and values. Our CEO is extremely passionate about everyone being on the same page in that regard. Like I said, we're a nonprofit OPO and tissue recovery agency. We are one of 58 OPOs in the nation and only one of 7 that's also a tissue recovery agency. We're regulated by CMS and the FDA. CMS regulates our organ side of things, and the FDA regulates our tissue side of things. This needs to be updated now. We have offices in North Liberty, which is where I'm from, and then Altoona and Sioux City as well. Our communications center, have you guys all made referral calls before? Very familiar with that process?
Yep.
So you're talking to our comm center. They are incredible people, donation specialists. They are actually today operating out of North Liberty. They're all crammed in our small conference room just for the night. So if you do happen to make a referral call tonight, there might be just a couple glitches, hopefully not, but tomorrow everything should be good to go. We have 2 dedicated tissue recovery suites. We call this our DITRs, and offsite capabilities as well. So we have 1 DITRs in North Liberty, 2 in Altoona now, and 1 at the University of Iowa for pre-autopsy cases, and 1 at the Iowa State Medical Examiner's Office for pre-autopsy cases as well. We partner with the Iowa Lions Eye Bank. We do want to say we are 2 completely different organizations. When you guys call us and make that referral call, we are taking the referral call for the eye bank as well, just to save you an extra phone call. However, we are different, so if they follow up with another phone call, we have no control over that, sadly. We wish we did, but just to kind of inform you guys on that for a little bit. So some legislation, first person consent. So the Uniform Anatomical Gift Act of 1968 established first person consent. You, as a living donor, can decide if you want, or as a living individual, can decide if you would like to be a donor once you've passed away. This is such a wonderful thing that's happened to Iowa. We've seen such an increase in numbers for donors. However, once you've passed, a lot of families have different opinions about donation, and just because you said that you want to be a donor doesn't necessarily mean you get to be a donor. It doesn't really mean that those wishes are granted, depending on how your family feels. So I really recommend, if you feel passionate about donation, to tell your family, tell your loved ones how you feel about it, because that decision for a loved one is very difficult at that dark time. Does anyone have any questions about that, first person consent? I guess I'll go into a little bit about organ donation. So if a person has decided that they want to be a donor, legally we can take organs if the family doesn't agree. We never have, but legally we can, because organs are seen as a life-saving gift. We cannot move forward with tissue donation because the family needs to fill out a medical social history, and if they don't agree with donation, they're most likely not going to fill out that paperwork, and the FDA requires that paperwork. So CMS, like I said, we are regulated. That's why you guys are required to call us after every death. And then HIPAA, we are HIPAA exempt. That's mostly important for out-of-hospital agencies to know that. They are protected to give us that information on that patient. So the impact. So one donor can save the lives of up to 9 people and enhance the lives of more than 300 people. I'll be honest with you, when I started this position, I really thought they made that number up. I thought it was really big and a really great number that just sounded fancy. However, I was at a conference in Des Moines a couple months ago, and a sister of a donor spoke, and her brother passed away 2 years ago, and he is now at the 2-year disposition mark, tissue disposition mark, which we can talk about in a little bit. But that's when you start finding out where your tissues have gone and how many people you've impacted. And on that day, he had impacted over 220 lives just in 2 years. So that number is not made up. He still has 3 more years to impact 300 people. So I think that's a really, really great reminder. So how do I register? I brought some brochures with me today. If you guys are interested in registering, that's what you see on the right-hand side. You just fill out the back, and we will put you into our registry. You can also go online and do it yourself, but the most common way, which you guys probably know, is at the DMV. They'll ask you if you want to be a donor. That's where we get most of our yeses from. And we are ranked number 6 nationally, which we are extremely proud of. And about 70% of Iowans have indicated yes, which is a really great number. Unfortunately, there are roughly about 30,000 deaths a year, and only a third of those individuals are dying inside of hospitals. And as you guys know, you are required to call us. So 2/3 of those individuals who are registered donors are not being called to us. So this is why we are working with out-of-hospital agencies like hospices, long-term care, EMS and fire, law enforcement, and funeral directors and medical examiners. We are also doing the same thing, going around giving them educations. They sometimes don't feel that they play a role in donation, but they really do. They can really get the ball rolling, and we may never know or hear of a death of a registered donor, registered individual, if they don't make that phone call. So it's very important for us to educate them as well. So just some quick donation facts. Anyone of any age can donate. We ask you to never rule yourself out, and actually the older the skin, it's lost its elasticity, it lost its stretch, so it is transplanted much easier to the recipient. It doesn't shrink when you transplant it. So in young individuals, we have a 4-month-old currently that is donating her heart. So everyone of every age can donate. Everyone's waiting for, anyone of any size and age is also waiting for that tissue or that organ. So a patient's income, race, or social status are never taken into account. You can't buy your way to the top of the list. There are so many factors that go into who gets what organ. Depending on where you were located. Hello.
Hello. Hi. I'll just kind of be in and out.
Okay. No worries. Depending on where you're located, your blood type, the body size, a 6'7" male's heart is not going to go into a 4'11" female. It just depends on body size, blood type, a ton of factors. You can never buy your way to the top of the list. Seems like the silliest little myth here. Thank you. The first priority is obviously to save the life of a sick or injured person. And when we give this presentation to hospital staff, it just seems extremely silly. However, it's quite sad when we give a public presentation. This is exactly what they think. They think if they have a yes marked on their driver's license and they get in a car accident, whoever's trying to save them will look at that and let them die, or they won't try as hard to save them knowing that they're a donor. And that's just absolutely ridiculous, but we do want to talk about that. There's no cost with donations. So the second we gain consent from the family, we take over all hospital bills. We take care of transporting and all the bills related to transporting. And if we miss something and the family gets billed for something, they can give that right back to us, and we'll take care of it from then. We do not take care of funeral costs, however. And all major religions in the United States fully support donation. We have a diversity task force that did a lot of research and found that if you feel your religion is not compatible with donation, to talk to your trusted religious leader and just have a conversation about it. We found that most religions view it as a charitable act. So, and an open casket viewing is possible with organ and tissue donation. We talked to the family beforehand, which we'll go into a little bit more detail later, but if they are, we've had a family who wanted to keep their son in his favorite baseball uniform, we would not recover the arms then, out of respect for the family. It's a conversation that happens before recovery, but definitely an open casket viewing is definitely, you can still have one if you are a tissue and organ donor. And all donors are treated with the utmost respect and dignity, and like I said earlier, I was on the recovery team, and this can't be any more true. Depending on your religious beliefs, we say a prayer before every case. We really honor and think it's a beautiful gift that donor is giving back to the community, to the United States, and it's a wonderful thing what that family is consenting to. So some more quick facts. Every 10 minutes there's another name added to the National Organ Transplant waiting list, and every day 21 people die waiting for that life-saving transplant. So there is a huge need for organs and tissue. Any guesses, United States, how many people are waiting for an organ? Too many? That's a common answer. Any guesses? Any range?
For United States?
Yep.
Doesn't Maine kind of look like it's kicking something? 1.5 million.
Ooh.
I was gonna say.
What about Iowa? 250. So, little under killer. So over 123,000, and then 571 in Iowa, and about 90,000 in the United States are waiting for kidneys. Kidneys are the number one organ people are waiting for.
Sure.
But as you can tell, so actually 571 is breaking. It's the lowest we've ever been in Iowa. So we are really proud of that number. However, that is still a really, really large number. So.
She was admitted over there.
All right, I'm scared to ask any Iowa State fans in here. Oh, I like this hospital. All right, well, picture these two stadiums together as one. This is your waiting room, waiting for an organ. Yep, Kinnick Stadium. This is extremely daunting if you are waiting for an organ, and you know that when these stadiums are packed on game day, that is your waiting room. Just to kind of paint a visual for you guys, but again, huge need to sign up to be a donor, and you guys serve as the dual advocacy. So you are the link between a potential donor and the recipient who is waiting for that life-changing gift. So we really appreciate every referral call. We've been listening to a lot of referral calls lately for training purposes, and you guys are so busy, and there's a million things going on in the background, and we just really, really want to say thank you, and we really appreciate all the time that you're giving us and making that referral call. So I'm going to talk a little bit about the organ process. You guys don't have a ventilator, correct?
Mm-mm.
Okay, so we'll just talk a little bit about it and focus mostly or mainly on tissue. So a lot of people think that you can be an organ donor if you die outside of a hospital, or if there's a scene death. That's just simply not true. You have to die on a ventilator inside of the hospital. So only 2 to 3% of the population are dying in a way that you can donate your organs, which is why there's a huge need, why there's such a huge waiting list for organs. But you have to either be brain dead or cardiac death. So once you remove the ventilator, you have to die within 60 minutes to be able to donate your organs. I brought some of these for you guys. This is a trigger card. This one up here is an organ trigger card. I brought you guys tissue trigger cards. It just reminds you, again, that's organ information on the right-hand side, but you guys call us an hour after each death, and then on the back of the trigger card is really great language on how to talk to the family and how to even approach that subject, which we will also talk about in a little bit. Moment of silence. I'll give you guys a second to read this. So on organ cases, if it's a full recovery, there could be 5 teams in there, and each team brings 2 fellows, and there's just, the whole room is completely packed. It's really chaotic. Surgeons are looking at the anatomy of the organ. We are holding up their cell phones to their ear when they're all scrubbed in. They're on the phone with the other surgeon back at home talking about the anatomy, when to prep their patient, their recipient. It's completely hectic, but when the IADN employee steps up and raises their hand and announces that it's moment of silence time, the whole room goes silent, and everyone is paying attention to what the family has prepared for the surgeons and for the team to listen to, and it's a great way to honor that donor. We've had a whole room of people crying before. We've had children before, which is always just terribly sad, and the moment of silences are filled with their favorite activities. And one donor we had, the brother, who was, I don't even think he was older than 10 years old, wrote the moment of silence, and it was really emotional. It's just a great way to honor the donor and really put the donor in the middle of everyone, middle of the room, and everyone's thinking about that donor and their life. Organ donation possibilities. So the heart, lungs, and small intestine have to be transplanted between 4 to 6 hours. So if you die in California, there's no way someone in New York is going to get your heart. That's why where you live and where someone passes away is so important. We've had the heart team come in. They are always the first one to get in and cross clamp and remove their heart. Sometimes we've seen it in less than 5 minutes. They give a little handshake to the team next to them, and they are back on their private jet flying back to their patient back at home. It's pretty hectic. And then the next step would be the liver or the pancreas. That I believe has 14 to 18 hours to be transplanted, a little bit longer there. And the kidneys, we have something really cool about with the kidneys. It's called a kidney pump. It extends the life from 24 hours to actually 48 hours, and so you can plan those surgeries more. You pretty much just perfuse the kidney, and fluids are being pumped through the kidneys, can keep them functioning. It's really, really neat. You can plan the surgery, and the surgeons can get some sleep if they're the ones doing the transplant as well. So transplants each year, as you can see, these numbers are extremely low compared to the people waiting for organs. Something we do like to note is there is over 1 million tissue transplants each year, and you rarely hear about tissue in the news, but it is just as important as organ donation. And I do have a story coming up regarding tissue donation, and obviously patient care comes first. We don't even need to mention that. Consistent and timely referrals, so call within 1 hour of death. Preserving the opportunity. So we do want to mention this really quickly, the funeral home. So there have been times where we will get a referral call and we don't know that the body has already been released to the funeral home, and somehow there's a miscommunication there. We'll either come up to pick up the body and it's not here, it's already with the funeral home, or if we find out too late the body's with the funeral home, they've already started the embalming process. They don't know that we're involved in the process, and unfortunately, once embalming has started, they can't be a donor anymore. So there have been times where families are really excited for their loved ones to donate. Unfortunately, there was a miscommunication somewhere down the line, and the body had already been embalmed. So we just want to make sure that the funeral home knows that we are involved, and we will give you the green light to release the body to the funeral home. And if that's already happened, just let us know. That's no problem at all. Is there anything else in here currently? No. So the referral call, you guys are all familiar with the call. They ask about your information, where you're calling from, the patient's information, any medical interventions, and then funeral home information, or if there's an ME involved. I brought you guys a resource. Please feel free to make as many copies as you want. This is a cheat sheet. It's a 1-pager cheat sheet, and it asks, this is exactly what we ask in the order we ask. So when we surveyed all of our nurses, or most of our nurses, they said the most frustrating part is the phone conversation when they don't know what's going to be asked next. If it's their first call, they're nervous, if they flip through the chart, or if they don't know much about this patient, and someone just gave them the chart to call in, it's really frustrating for them, and the phone conversation lasts a lot longer than it needs to. So if you want to fill this out beforehand, then call. It makes the process a lot easier. I don't know who to give this to. Okay, thank you. This is also another resource just for probably new employees or someone who's not familiar with the process. Just a quick one-pager as well. So after you guys call us, this is kind of what happens behind the scenes. We will evaluate the suitability and check the donor registry. We'll go through the medical records as well, and we'll ask you guys to prepare the family. So what that means is, I have some language coming up, but not asking for their decision. Just preparing the family and telling them that a donation specialist is on the phone, and it's one of the end-of-life decisions that has to be made regarding donation, and a donation specialist would like to speak to you on the phone. That's how we would like you to prepare the family in a private setting, and then we would ask for the chart to be faxed to us as well, and then place ice on the body. So pretty much we just mentioned this, but preparing the family, introducing them to the end-of-life decision about donation opportunities. You guys play a really vital role in creating that safe environment. We ask that it's a private setting. And then we will provide families with information about donation and ask them for their informed decision. And the quote at the bottom is the ideal language we would like you guys to use. I know it kind of sounds robotic, but it's not searching for a yes or no answer. And we want to take that pressure off you guys. We don't want you to have to go ask for that answer. It's a lot of pressure if you don't know much about donation, or we want them to have make a well-informed decision. And if you do approach the family, it's not a ding on the hospital. However, it gets marked in our system as a family approach. So appropriate requester rate, we do keep track of. And I do have some notes here. So in 2012, you guys had 2 donors, 35 referrals. You didn't miss a single death, which is really great. You guys are a wonderful hospital to work with. However, 4 out of the 6 potential donors were approached by a staff member, and so about 67% was the appropriate request rate. So that sounds really negative. However, 2013, you guys were 100% appropriate request rate, so nobody approached the family for their decision. So that was a huge change. That was wonderful to see, and you had 1 donor in 2013. 2014, the reports are being made right now, so I don't have the appropriate request rate number. However, you had 3 donors. 1 was discontinued, nothing to do with you guys. It's something that we found in the medical records afterwards, and you referred 29 deaths to us. So that's wonderful. We love to celebrate hospitals like you guys. And does anyone have any questions about appropriate request rate? I feel like it kind of, is that confusing at all for anyone? So when we talk to the families, these are the things that we talk about. We talk about the life-saving and life-enhancing possibilities. We talk about reconstruction and open casket viewing. Reconstruction, so out of respect to the family and the donor, we reconstruct every single recovery. This adds about an hour or 2 to each case, but we do it purely just out of respect for the family. Any religious or cultural concerns, tissue allocation or recipients. So organ cases, you know exactly who those organs are going to. We can share the age and sex of the recipient. We can't share the location or anything like that, but that really helps families during that grieving moment for organ donation. And we talk about family support and some events that we have for donor families. That obviously that conversation happens later. It's no cost to the family. We talk about the timeline of the process, and we also want to mention no guarantees. So being in recovery, we, for example, had a woman who was elderly and very, very thin. So we were kind of questioning if we were going to get enough skin, and then we flipped her over, and her whole back had these moles on it, and unfortunately we can't recover that skin. So we had to discontinue the case. So there's no guarantees. The family still got the pins and bracelets, and we still really honored their wish, and we're really grateful that they wanted to be a donor. However, we just couldn't move forward. That's why we say no guarantees. This is a little bit about the timeline. The one thing I just want to mention from here is that we have 24 hours to recover. And that sounds like a really long time. However, when you add in all of these factors of what needs to be done, it's really not that long at all. We've had seconds where we know we have to get the veins on ice, and we've got it right down to the minute where we're placing the veins on ice on the minute. So 24 hours really is not a long time. Tissue recovery could last for skin only 2 to 3 hours. Skin and bone anywhere from 4 to 6 hours, and then if it's a full case including the heart and veins, that can, my personal longest one was 9 hours. So that's a big chunk of time, especially if it takes 4 or 5 hours to get paperwork done, or to transport the body or the donor as well. So 24 hours total. This is a sign in the back of our ditters that we read before every case. Just to honor the donor and their family. It's a great reminder. So tissue donation possibilities. So the eye, they are not recovering whole globes for transplant at this moment, just corneas. They can take the whole globe for research purposes. That's the eye bank. We don't recover the eyes. Heart valves to replace damaged heart tissue. Bone, you can donate long bones, or they could couple your bone with your adipose tissue for spinal fusion surgeries. And I have a photo of that coming up, but adipose tissue allows the recipient's body to accept that bone a lot quicker and easier. That's a really tough word for me to say, but I think that's really, really neat. And skin for burn victims, and they serve as a temporary wound patch as well, is what they call them. I have an example of a young woman who burned her hand coming up. I'll show you guys. Veins help with cardiac surgeries as well, and then connective tissue. I'm not sure if you guys are a football fan, but Carson Palmer, he's a quarterback in the NFL. He tore his ACL about 7 years ago, and a woman donated her tissue, and her Achilles tendon went and replaced his ACL and gave him, I believe, 6 more years in the league. He met her mother, and before then she did not care a lick about football, and now she watches every Sunday. They're really close. It's a really beautiful story. It was on ESPN recently, and we love seeing tissue stories in the media because mostly they're organ related. Unfortunately, he just retore his ACL a couple months ago, and he has a new donor tissue in his knee now, but really great story. He's really close with that family still. So after the tissues are done being processed, this is what they look like. There's a skin graft in the top left, some cartilage right in the middle. Top right is adipose coupled with bone, and then the spinal fusion grafts in the bottom right. So just to show you guys, this is the impact of tissue donation. This is a 13-year-old girl, severe scoliosis, as you can see. 2 years later, as a 15-year-old, this is her after tissue was donated after a spinal surgery. So tissue is seen as life-enhancing, but I guarantee if you ask this young girl, that is definitely life-saving. Her life is completely different after tissue donation. And this is the picture of Megan. She was working in a factory, and she had a glove on, and she was actually degloved, and some of her skin clearly came off with the glove. Day 1, 3, 7, and 9. These pictures are really hard to look at, and I apologize. After day 9, she received a skin donation, a skin transplant, and you can tell it's meshed by the pattern of the skin. So her hand is healing, and this is her, I believe that's 30 days after the transplant, and this is her today. I'll give you guys a second to read a letter from a donor, or from a recipient to a donor family. So how these letters work is that Iowa Donor Network serves as the middleman, and if a recipient really wants to reach out to that donor family and send them a letter, they send that letter to us, and we will reach out to the donor family and tell them they got a letter, see if they want to hear from the recipient. Some families can't wait to get those letters. They really want to hear from the recipients, and other donor families don't want to hear from the recipients. It's too much of a hard time for them. It's going to be years after the fact. It's just they don't want to hear anything from the recipient family, and we totally respect that. So we will keep those letters forever. We'll let the recipient family know yes or no, and we just had a heart recipient meet her donor family a couple months ago at the university, and she met the children of the donor who gave her her heart, and it was really beautiful. She wears a pin of her donor's face and favorite color every day, and it's a really great way to honor that donor and her family. The Eye Bank would like us to talk just a little bit about their process. Something to mention, they don't have a waiting list. Corneas, if you need a cornea, you're pretty much guaranteed that you're going to get one, which is really neat. One donor can impact 2 people's lives. One cornea goes to 2 different people, or 2 corneas go to 2 different people. They ask, though, that you would elevate the head and put sterile saline drops inside the eyes, close the lids, and use tape if necessary once the family has left. Put ice over their eyes, and then document in a chart when ice was put on their eyes. Some tissue donation follow-up. So some hospitals and some out-of-hospital agencies have no idea that we have a follow-up to the donation process. We actually have a whole department in our company called Family Donor Services. And they do the day after donation phone call, just as a check-in. They do the 1-week letter letting them know what was recovered. The 1-month phone call, so they're checking in, providing grief material. 6-month letter, they're checking in again. They talk about the quilt program. They ask if they need anything. They invite them to any events that we're hosting. Grief material again. 1-year anniversary cards. So when we surveyed our donor families, some great feedback we heard was that when your loved one passes away, you never forget that day. And some people in your community or your close friends might forget that exact day, but they said it's so nice to have someone just be there for them on that day. It's a card saying we're here for you. Let us know if you need anything. And we found really great feedback from that. And then a 2-year disposition. So this is the sister I was talking about earlier. Her brother was at the 2-year disposition. So that's when you get to find out exactly where those tissues are going after they're processed. Tissue has a 5-year shelf life, so it does take up to 2 years for tissue, though, to know exactly where those tissues are going. Again, so some family support services, that medallion, each family gets the medallion in the middle. They get those bracelets and pins. Some families want 50 bracelets and pins, others want 500. We will accommodate whatever they need. We do for organ donation cases thummies, so we take thumbprints of the donor and we can make necklaces out of them and give them to the children, or really whatever the family needs, we will accommodate. And I have a short video. It's about 4 minutes long. His name is Joey Gase. He's a NASCAR driver out of Cedar Rapids, Iowa. I'm not sure if you guys have ever heard of him, but he is a wonderful advocate for donation, and you will understand why.
Jordan Shaw seems to have very little in common with
Is that too quiet? Okay, I wouldn't kind of hear that.
today's top drivers. The 26-year-old has had a history of life-threatening kidney problems and underwent a failed transplant when he was 16 years old. He's been waiting for a new one ever since.
When I knew I wanted another transplant, there was a little, almost depression. You don't like to think about that. I just went on my days and hoped I would get a phone call getting my transplant.
Through his own tragic circumstances, nationwide driver Joey Gase would create a connection and a lifelong fan. It was 2 years ago that the then 18-year-old Gase found his mother collapsed in their home.
I saw my mom laying on the ground, but she was breathing really, really funny and weird. And then I went to the hospital, and they had the doctors look at her, run a few tests, and they said that they don't think she's gonna make it.
Gase's mother, Mary, died that night from a brain aneurysm at the age of 44. But doctors give
sign all the paperwork, because a few months before that was my 18th birthday, and my mom wasn't married, so I was the one who needed to had to do everything, and then they told us we had to start thinking about if she would want to be an organ and tissue donor. And so we thought about it, and we knew my mom, she always liked helping people.
Gase's decision meant that Jordan Shaw's 5-year wait for a second transplant was finally over.
The night before the transplant, I didn't sleep. You just have a lot of things going through your mind. You do think about the person that passed away. The things happen. How am I going to live this life to honor this person?
The surgery a success, Shaw has been living an active life since, but he never forgot the family whose gift saved him. He wrote a letter to Gase to express his thanks and got an invite to meet in return.
In August of 2012, I got a letter from Joey Gase. And he said, I am a NASCAR driver out of Cedar Rapids, Iowa. And I have a race coming up next week in Newton, and I would love to have you there and meet you. I didn't hesitate at that at all. I went straight for it. Nice to meet you. Good. Absolutely. Finally putting a face, a name to my kidney, it really came full circle for me. I can't say thank you enough, Vince.
Meeting Jordan just put everything in perspective for me and my family, and knowing that my mom was able to live on through him, and how big of an impact my mom made in his life.
And then you grew up fast. You're fine, let it go. There's plenty of people that you won't help. I'm here.
Organ donation has become a platform for Gase, and at both races at Iowa this year, he showcases his support for the cause with the Donate Life America card. His mother's image featured prominently on the hood.
I just feel so fortunate to be able to do that, and also be able to honor my mom.
It's speechless. These people passed away and they've said,
I mean, that was the end of the video, but sorry for that awful ending there. But as you can tell, I mean, Joey and Jordan go around and talk for us. They are great donation advocates for us, and we really, really love Joey. And he picks a different family each race to have the photo next to his mother on his car, so we think it's really, really special. Are there any questions? Can I answer anything for you guys? That is the end of the presentation. I'd love to answer any questions you guys have. Anyone? All right, well, thank you guys so much for coming. I'm here again on the 3rd if you guys just want a double presentation or you want to hear it again. But thank you guys so much and have a great night.
Thank you.
Thank you.